All right, if you're prepping for the NCLEX, you know those endocrine questions can be a real headache, right? Well, today we are pulling back the curtain on the one framework you absolutely need to master them. First things first, you've got to get this in your head. The NCLEX doesn't care if you've memorized every single lab value. What it really wants to know is, can you spot a patient who is dangerously out of balance? That's the whole game. And this is the honest truth, both for your patient and for your exam score. These hormonal shifts can make a patient go downhill so fast. If you miss those little subtle clues at the beginning, you are already playing catch up. And this, right here, is the absolute heart of it. Yeah, knowing your anatomy is great, but the real question is, can you walk into a room, assess a situation, and know the number one thing you have to do to keep that patient safe? That's what separates a pass from a fail. So let's do this. For the next few minutes, we're going to give you a little preview. We're going to walk through the exact thinking process that the NCLEX expects when it comes to endocrine emergencies. This is really the core of what we teach at Exam Coaches. So let's just start by talking about the real problem here. Why are these questions so tricky for so many people studying for the boards? Does any of this hit a little too close to home? You're not alone, I promise. It is so easy to get tangled up trying to remember which syndrome is hyper and which is hypo. Or you memorize a lab value, but you don't really get what it's doing to the patient. But here's the good news. All of these struggles, they come from the same root problem. The biggest reason people stumble is they miss those early crisis signs and then freeze up, not knowing what to do first. So the big takeaway here is we have to shift our focus. It's not about listing hormones and their functions. It's all about recognizing when your patient is unstable. That, right there, is the key that unlocks all of these questions. Okay, let's put this into practice. We're going to start at the very top with the pituitary gland. How do we spot those first little clues that something's wrong? What's so cool about this is how these cues all tell a story. With hypopituitarism, everything is just slowing down. You've got fatigue and hypotension because the cardiac output is low. And those neurosigns, the headaches and vision problems, they're not random. They're pointing you toward a potential cause, like a tumor messing with the gland. Okay, so here's a classic NCLEX-style moment. You walk in the room and this is what you see. Now, there are a bunch of things you could do, but what is the absolute number one priority to keep this patient from crashing? Our framework trains you to cut through all that noise and lock in on that single most important action. All right, now let's flip the script. With hyperpituitarism, or acromegaly, we see overgrowth. The big hands and feet are the classic textbook sign, sure, but the NCLEX is going to test you on the stuff that can kill your patient, like hypertension that spirals into heart failure, or dysphagia, difficulty swallowing, which is a huge airway risk. And here's another one of those clinical judgment questions. Your patient just says they have a headache, but in this patient with this condition, what does that really mean? Is it just a headache, or is it a screaming red flag for something serious like rising intracranial pressure from that pituitary tumor? Knowing how to tell the difference is everything. Okay, let's take the same way of thinking and apply it to two of the most mixed up topics in all of endocrine, the fluid crises of DI and SIADH. And here is where it all clicks. This is the logic. Instead of trying to memorize two totally separate lists of symptoms, just think of them as complete opposites. For DI, diabetes insipidus, think dry inside, right? There's not enough of that antidiuretic hormone, ADH, so the body's just dumping tons and tons of diluted urine to get super dehydrated. Now for SIADH, think soaked inside. It's the exact opposite. They have way too much ADH, so they're holding on to all this water, creating this huge fluid excess, and that leads to that really dangerous dilutional hyponatremia. So the second you see DI, your brain needs to go into emergency mode. You're hunting for signs of hypovolemic shock, huge urine output, blood pressure dropping when they stand up, all the classic signs of dehydration. This is a fluid volume deficit emergency, plain and simple. I mean, just look at those numbers. That is a crisis unfolding right in front of you. So what do you do first? Is it a med, a phone call, an IV? The NCLEX demands that you know the right move in the right order. Now for SIAD, your brain has to switch gears. Now we're in safety mode. The big danger here isn't getting dry, it's fluid overload, causing the brain to swell, cerebral edema. And that's exactly why you see those mental status changes. Their body is so waterlogged that their urine becomes super concentrated.
And here it is, the classic triad. They're confused, their sodium is low, and their urine is concentrated. This patient is a huge seizure risk, so what is your very first action to keep them safe? This is the kind of thinking the NCLEX is built on. Okay, so we've looked at pituitary issues, we've looked at these crazy fluid crises. How in the world do you pull this all together into one simple framework that you can actually use on test day?
Well, it really boils down to this. 3 simple steps. Your number one job is to detect instability. That's it. See the problem. Then, once you see it, your immediate next thought is, how do I act safely? And once you've done that, you prioritize your monitoring to make sure they stay safe. This works for every single endocrine emergency.
And that's really what we do at Exam Coaches. We don't just dump lists of facts on you and hope you memorize them. We actually train you how to think like a safe, effective nurse. We train you to recognize that imbalance, to choose the right priority action, and to do it safely and quickly, every single time. And you have to remember this. The NCLEX isn't trying to trick you with the most complicated answer. It's looking for the safest nurse. The safest, most timely action is always, always the right answer. Look, this was just a little sneak peek into how we break down these really complex topics. The entire framework with all the interventions, the rationales, everything you need to walk into that exam feeling totally confident, it's all waiting for you inside the platform. Thanks for listening.